Hello, everyone. My name is Banke Banjoko. Today, I will be discussing Rosemary Rizzo Pars's human becoming theory, how it aligns with my epistemological nursing stance, and how I would apply it to a practice scenario from my role as an emergency department nurse. As nurses, we have the opportunity to understand not only what is happening medically, but also what the experience means to the person living it. So sit back, relax, and join me as I imagine sitting down with Dr. Rosemary Parse to explore how her theory can guide my nursing practice. Rosemary Rizzo Parse is a contemporary nurse theorist known for developing the human becoming theory. Her theory was first introduced in 1981 as man living health and was later renamed human becoming. Her theory continues to influence nursing education, research, and practice by encouraging nurses to focus on human experience, personal meaning, and quality of life. What is the human becoming theory? The human becoming theory offers a different way of thinking about nursing. Rather than asking, "How can I fix this patient?" Parse encourages nurses to ask, "What does this experience mean to this person?" According to this theory, people are not passive recipients of care. They are active participants in their own lives who create meaning through their experiences, relationships, choices, and interactions with the world around them. The nurse's role is not to direct the patient's life or decide what is most meaningful for them. Instead, the nurse is present with the patient, listens without judgment, and supports the patient as they make choices that reflect their own values and understanding of health. Parse's theory is built around three major principles: meaning, rhythmicity, and transcendence. Meaning refers to the way people understand and give significance to their experiences. In nursing, this means that the nurse must try to understand what illness, loss, recovery, or health means to the person experiencing it. Rhythmicity refers to the patterns and paradoxes people live with. Patients may experience hope and fear, strength and vulnerability, independence and dependence, or connection and separation at the same time. Transcendence refers to moving beyond the present moment and creating new possibilities. This does not mean ignoring suffering or pretending everything is positive. Instead, it means supporting the person as they begin to see new ways of living within their situation. An important assumption of Parse's theory is that individuals are experts in their own lives. The nurse does not know what is best for the person in a complete sense. Instead, the nurse partners with the person as they define health and quality of life for themselves. One major strength of Parse's theory is that it supports individualized, person-centered nursing care. It reminds nurses that care should not be based only on diagnosis, routine, or protocol, but also on the person's meaning, values, and choices. Another strength is that it encourages true presence as opposed to task-based interactions with the patient. However, the theory also has limitations. Parse's theory is abstract and philosophical, which may make it difficult for some nurses to understand or apply in practice. It may also be challenging in emergency settings where nurses must act quickly, prioritize safety, and provide immediate interventions. For this reason, I do not see Parse's theory as replacing clinical judgment or evidence-based care. Instead, I see it as a valuable lens that can deepen the way nurses understand and respond to patients. Nursing knowledge is developed through more than scientific evidence alone. While clinical knowledge and evidence-based practice are essential, I also believe nurses gain knowledge through therapeutic relationships, clinical experience, ethical reflection, and understanding each patient's lived experience. This connects closely with my view that nursing is a relational and context-responsive practice rather than a standardized set of tasks. Parse's theory reflects this perspective by recognizing that every individual creates their own meaning of health, based on their experiences, values, and circumstances. Rather than assuming that every patient needs the same approach, Parse encourages nurses to understand the person behind the diagnosis and support them in ways that are meaningful to them. Dr. Parse, thank you for meeting with me today. Recently, I cared for a patient in the emergency department whose situation stayed with me long after my shift ended. I would really value your perspective on how your human becoming theory could guide my nursing care. Thank you. I'm grateful to be with you today. This is your journey, and I look forward to understanding what this experience means for you. A 19-year-old university student named Jacob was brought to the emergency department following a motor vehicle collision. After assessment and imaging, the healthcare team explained that he had sustained a severe spinal cord injury with a high likelihood of permanent paralysis. When I entered his room, Jacob refused to make eye contact. He quietly said, "My life is over." His parents were devastated, while Jacob refused to speak with anyone or participate in discussions about his care. As his nurse, I found myself wondering how I could support him during one of the most life-changing moments of his life. Dr. Parse, my first question would be, how can I better understand the meaning Jacob assigns to his spinal cord injury rather than focusing only on the physical diagnosis? I ask this because human becoming theory teaches that individuals create their own meaning from life experiences. Before I can provide meaningful support, I need to understand what this injury means to Jacob. My second question would be, how can I be truly present with Jacob without trying to immediately solve his emotional pain? I ask this because nurses often feel pressure to comfort or fix distress quickly. However, Parse's theory emphasizes true presence, which requires being with the person without judgment or control. My third question would be, how can I respect Jacob's choices if he initially refuses to engage with his care? I ask this because Parse's theory values human freedom, choice, and self-determination. At the same time, emergency nurses must balance respect for autonomy with safety, advocacy, and duty of care. My fourth question would be, how can I recognize the paradoxes Jacob may be experiencing, such as hope and despair, independence and dependence, or strength and vulnerability? I ask this because rhythmicity reminds nurses that people may experience conflicting emotions at the same time. Recognizing these paradoxes can help me avoid judging Jacob's silence or withdrawal as noncompliance. My fifth question would be, how can I support Jacob in beginning to see new possibilities for his future without giving false reassurance or minimizing the reality of his injury? I ask this because transcendence is about moving beyond the present moment toward new possibilities. In Jacob's case, this means supporting him gently, while respecting that he may not yet be ready to imagine life differently. Reflecting on Parse's human becoming theory, I can see how this knowledge would be helpful in my current role as an emergency department nurse. It reminds me to look beyond the diagnosis, the behavior, or the immediate clinical problem and consider the person's meaning, fears, values, and circumstances. In my practice, this theory can help me build stronger therapeutic relationships, provide more individualized care, and remain present with patients during moments of uncertainty, grief, or crisis. At the same time, Parse's theory may not always be fully applicable in emergency nursing. In life-threatening situations, rapid assessment, clinical judgment, safety, and immediate intervention must come first. However, even in a fast-paced environment, Parse's theory reminds me that every patient has a unique story, and every encounter is an opportunity to understand it. Thank you for watching my presentation.